A very good evening to all of you. Today we are going to do obstetrics and gynecology. This obstetrics and gynecology is a very important subject as far as NEET PG is concerned. About 30 questions come from obstetrics and gynecology, especially the oncology part and the labor part and the fetal skull part and the maternal pelvis part. So let us begin with the first question. The more you practice the questions repeatedly again and again, the more the chances of getting a good score in your NEET PG and INICT exam. So let us begin with the first question. Zygote with zona pellucida reaches uterine cavity by A. 2 days, B. 4 days, C. 5 days, and D. 6 days. What do you think is the correct answer here? Zygote with zona pellucida reaches uterine cavity by A. 2 days, B. 4 days, C. 5 days, and D. 6 days. Any guesses? Please reply in the chat box. Well, the correct answer here is B. 4 days. The role of human placental lactogen is A. Stimulate milk production, B. Fetal breast development, C. Growth of fetus, D. Endocrine regulation. So the correct answer here is C. Growth of fetus. Most common site of implantation of tubal pregnancy is A. Interstitial portion of fallopian tube, B. Isthmus, C. Ampulla, D. Infundibulum. The maximum propensity to rupture is ischemic ectopic pregnancy. Minimum propensity to rupture is ampullary ectopic pregnancy. So most common site of implantation of tubal pregnancy is ampulla. Please click the link in the description box to join the 2-day NEET PG Ultimate Breakthrough Blueprint Masterclass. It is really an ultimate breakthrough because it will cover the 19 subjects in a super fast manner so that you will revise the things fast and you will know what to study and what not to study. So the first 10 people who click the link in the description box will get this masterclass absolutely free. It is an online live class, and the content of this class will be mind blowing. It will take you to the next level of preparation, especially those people who don't get the time to prepare due to the duties and all those things. Some people in service candidates are there. Some students do study, but due to some conditions, the revision is not proper. For those people, it will be very beneficial. So let's move to the next question. During which gestational age is peak serum HCG level attained? A. 7 to 9 weeks, B. 11 to 13 weeks, C. 20 weeks, D. 25 weeks. It is 77 to 9 weeks. The HCG rises progressively from conception. The levels double on an average every 30.9 hours until the values reach 6,500 milli international unit per ml or 6,500 international unit per liter at approximately the 8th week after the last menstrual period. After that, the rate of rise becomes individualized, peaking between 60th and 70th day, that is 9 to 10 weeks LMP. HCG decreases slightly between 12th and 16 weeks post LMP and then remains constant until birth. So the correct answer here is A, 7 to 9 weeks. What would be the type of presentation when engaging diameter is mento-vertical? A. Face. B. Brow. C. Vertex. D. Breech. In brow presentation, the engaging diameter is mento-vertical 14 centimeter. Brow is the rarest variety of cephalic presentation where the presenting part is brow and the attitude of head is short of that degree of extension necessary to produce face presentation. Now, what about face presentation? In face presentation, the presenting part is face. Attitude of fetus shows complete flexion of limbs with extension of spine. The commonest position is left mento anterior. The engaging diameter of head is submento-brachmatic 9.5 centimeter in fully extended head or submento-vertical. So the correct answer here is B, bro. Most common cause of secondary PPH is A. Uterine inertia, B. Retained placenta, C. Episiotomy, D. Cervical tear. It is retained placenta. Incidence of scar rupture in a subsequent pregnancy in case of lower segment cesarean section is A. 2%, B. 4%, C. 5%, D. 8%. It is 2%. The risk of lower segment scar rupture is low. It is 0.2 to 1.5%. And even if it does occur, maternal death is much less and perinatal mortality is about 1 in 8. So the correct answer here is here 2%. Subpubic angle is A 60 less than 65 degree, B 65 to 75 degree, C 85 degree, D 110 to 120 degree. It is 85 degree. Rule of Hasse is used to determine A. The age of fetus, B. The height of an individual adult, C. Race of a person, D. Identification. Hasse's rule is employed in calculating the age of fetus by its length. During the first 5 months of pregnancy, the length in the it is square of age in months. So the correct answer here is B. A. The age of fetus. Indication of acyclovir in pregnancy is disseminated herpes, B. Chickenpox in first trimester, D. Prophylaxis in recurrent herpes, D. All of them. Correct answer here is D. All of them. Human placenta is A. Discoid, B. Hemochorial, C. Deciduate, D. All of the above. It is D. All of them. Hot flushes are experienced as a result of A. Increased noradrenaline, B. Decreased estrogen, C. Increased noradrenaline, decreased estrogen, D. Increased noradrenaline and estrogen. The correct answer is increased noradrenaline and decreased estrogen. Cephalic index is A. BPD upon OFT, B. BPD upon HC, C. OFT upon BPD, D. HC upon FL. It is BPD upon OFT. In MRKH syndrome, which among the following is absent? A. Vagina, B. Breast development, C. Pubic hair development, D. Testis. Now, what is MRKH syndrome? It is also known as Merck's syndrome. That is Mullerian agenesis, renal aplasia, cervicothoracic somite dysplasia. MRKH means Mayer-Rokitansky-Kuster-Hauser syndrome has a karyotype of 46XX, so gonads present are ovary, in contrast to androgen insensitivity syndrome, where testes are present. Remember, in androgen insensitivity syndrome, testes are present. The MRKH syndrome is characterized by congenital aplasia of uterus and upper part of vagina in women, showing normal development of secondary sexual characters and a normal 46XX karyotype. So the correct answer here is D. Testis. Polyspermia is inhibited by which ion? A. Ca, B. Na, C. K, D. Potassium chloride. So the correct answer here is A. Calcium. Maximum amniotic fluid is at A 32 weeks, B 34 weeks, C 36 weeks, D 40 weeks. It is 36 weeks. Fertilization usually occurs in which part of fallopian tube? A. Fimbrial and B. Ampulla. C. Interstitium. D. Isthmus. Fertilization is a process of fusion of spermatozoon with mature ovum. It begins with sperm egg collision and ends in production of a mononucleated single cell called zygote to initiate the embryonic development of egg to restore the chromosome number of species. It is always occurs in ampullary part of uterine tube. Physiologic change in leukocyte numbers in pregnancy is A. Neutrophilic leukocytosis, B. Lymphocytic leukocytosis, C. Neutropenia, D. Basophilic leukocytosis. It is neutrophilic leukocytosis. Weight of uterus at term is A. 400 to 500 gram, B. 600 to 700 gram, C. 800 to 900 gram, D. 900 to 1000 gram. This is 900 to 1000. See, the uterus in non-pregnant state weighs about 60 gram with a cavity of 5 to 70 ml and measures about 7.5 centimeter length. At term, it weighs around 900 to 1000 gram and measures 35 centimeter in length. So at term, it is 900 to 1000. Please click the link in the description box to join the ultimate 2-day Neet PG Breakthrough Blueprint Masterclass. Urinary retention earliest in pregnancy is seen at urinary retention earliest in pregnancy is seen at A 10 weeks, B 18 weeks, C 22 weeks, D 34 weeks. Urinary retention in pregnancy is rare. It is classically described in some women with retroverted uterus, which becomes impacted in the pelvis, usually seen earliest between 8 to 12 weeks of pregnancy and causes the outflow obstruction. So the correct answer here is A 10 weeks. Down syndrome is earliest diagnosed at A 8 to 10 weeks, B 10 to 12 weeks, C 12 to 14 weeks, D 14 to 16 weeks. It is 10 to 12 weeks. When is folic acid started in pregnancy? A 4 weeks prior to conception, B 8 weeks prior to conception, C 4 weeks after conception, D 8 weeks after conception. It is 4 weeks prior to conception. Term placenta weight to baby weight ratio is A 1 is to 3, B 1 is to 4, C 1 is to 5, D 1 is to 6. It is 1 is to 6. Placenta at term is circular disc with a diameter of 15 to 20 centimeter. It has a thickness of 3 centimeter at the center and thins towards the edges. It feels spongy and weighs about 500 gram. The ratio of placental weight at term and that of baby weight is 1 is to 6. Always remember this. It occupies about 30% of your time. Persistent OB position is most common in which pelvis? A. Android pelvis, B. Gynecoid pelvis, C. Anthropoid, D. Mixed. It is android pelvis. Pregnant uterus will compress ureters at A. Pelvic brim, B. Utrovesical junction, C. Trigone, D. Utrovesical junction. It is A. Pelvic brim. If you have any doubts, you can ask in the chat box, please. Wishing you all the best for your NEET PG exam.